Whoa. Good morning. I think if everybody could take their seats, we'll get started with the session. Let's give you a moment. Welcome to this session, which is session 6B, Transitioning Away from Fossil Fuels and the Role of Clean and Efficient Energy to Protect Health. I'm John Samet from the Colorado School of Public Health, and I'll be moderating. I have housekeeping things I'm supposed to say, like mobile phones on silent or vibrate during the sessions. Actually, we could even have a mobile phone-free session where you actually put them in your pocket and don't look at them and see if it's possible. In any case, and then of course we'll be following this session with lunch, which comes at 1 o'clock. So I think those were the critical things I was told to say. And I'm just going to make a very brief introduction. There are 15 words in the title for this session. Transitioning away from fossil fuels and role of clean and efficient energy to protect health. And I was thinking about those 15 words. So much is captured in what we're supposed to be talking about. So much that is important, so much that cuts across the whole theme of this conference, and so much that is so difficult. And I think 10 years ago, perhaps, I began to see sessions like this as I traveled through meetings about air pollution and climate change. I will make a prediction with some certainty that 10 years from now, there will be sessions with exactly the same title, hopefully with progress made. And we have folks in the room who are monitoring that progress. And let's hope that sessions like this continue to make what are critical advances in spite of hiccups like we might be experiencing in the United States. So with that, I will turn to our presenters. We'll begin with Marina Romanello, who's Executive Director of the Lancet Countdown. Marina. There you are. Okay. I think everything is here.
Thank you so much. Thank you very much, everyone. I'm really delighted to be here with you, and particularly for this session, kind of focusing on the clean energy transition for health. I'm going to share with you some of the findings that we have from Lancet Countdown and from a few other sources that show us which are the opportunities and the priority sectors for action on climate change and health. It's a lot that you would have heard already throughout the past few sessions. But just to say, much of what I'm going to show you, I'm going to go through it very, very quickly. It's in our report. This is very temperamental. It's in our report that we published last November, so you can look at that in a lot more detail that I'm going to go through in the Lancet report from last year, the 2024 report of Lancet Countdown. But just to start from the very beginning, I'm sure you're all very aware of this and you've seen this data a million times, but I think it's important to keep in mind what we're talking about here. We've already experienced something around 1.3 degrees of global mean heating. The latest data suggests that we're currently probably in the early years of the 10-year average of a 1.5 degree world. So climate change has been fueled by the burning of fossil fuels, and a priority sector of action is tackling our greenhouse gas emissions to keep temperatures as close as possible to that 1.5 thresholds and have the best chance of survival. The energy sector is by far the biggest single contributor to greenhouse gas emissions. And the good news is that we know how to mitigate our energy sector. It's a sector in which we have technology to mitigate. We know how to improve the efficiency in the energy that we use. But the concerning trend there is that anything that you see there in like gray is the current contribution of fossil fuels to the global total energy supply. So as you can see, 81% of the total world energy still comes from fossil fuels. And Even more concerningly, although we've all agreed in Paris in 2015 that we would do our best efforts to keep global mean temperature rise to 1.5 degrees, and we all know that tackling energy emissions is the main activity that we should promote, we still see that energy-related greenhouse gas emissions keep on rising year on year, breaking every subsequent year the previous year's record. So global CO2 emissions from the energy system increased by 1.1% from 2022 to 2023. They grew again in 2024 according to the preliminary data. And again, we're growing very rapidly the adoption of clean renewable energies, but by and large, we haven't managed to displace fossil fuels. So that 3.1% that you see there is all of the global contribution to the total energy supply from clean renewable energies like solar, wind energy, geothermal. So that is what we really need to be increasing. So beyond talking about energy, this, as you all know, is critical for health. In 2021, we and many others estimate similar estimates of about 8 million deaths from PM2.5 air pollution. This includes both anthropogenic and natural sources. And one thing that I did want to note, when we talk about natural sources of air pollution, we oftentimes forget that climate change is also increasing those. So we're not only exacerbating the air pollution through the burning of fossil fuels and biomass and other activities in the agricultural sector, but also through the contributions of climate change itself to desert dust, sandstorms, and air pollution from, for example, wildfires. One thing that I did want to show you in that graph, I'm realizing now that you probably don't read the letters in that graph, but basically what that graph is showing you is that there's an enormously high amount of contribution that comes from anthropogenic sources. And when we break down that by sector, we see a huge amount of contributions that come from sources that are very easily replaceable with adequate interventions. And easy here is a very relative term. But for example, from the power plant sector, it's by and large the contribution of fossil fuels coming from the burning of coal. We know that coal is quite inefficient as a fuel. It's also quite expensive. The problem with coal is that it's available locally to many countries, and that's why we keep on using it, but it's very, very highly polluting. So it's the main source of contribution from the power sector. We also see in the transport sector, by and large, the main source of contribution is the burning of liquid fuels, petrol from our cars, particularly in urban centers, the biggest contributor. We know that we can transition to much healthier transport systems by encouraging both kind of the use of public transportation whenever possible and feasible, active travel whenever possible and feasible, and if not, transferring to electric vehicles and non-emitting sources of transportation if possible. One area there, and I know that this is not the focus of this session, but I did want to note that when we look at the household sector, that green area that you see there has to do with biomass, with the burning of biomass in the household sector. And I'm going to go to that in a moment. But we also have a lot of contribution, those pink values that you see there, particularly for waste and agriculture, that come from activities that are from outside the energy sector. And we must not forget the contribution of agriculture to air pollution as well. Very, very substantial contributions there. Is one of the highest contributing sectors. And one thing that I did want to show you is the death from ambient air pollution derived from coal. And you can see that breakdown normalized per population size by different world regions. You can see there Asia and Europe being the two world regions that have the biggest death rate from air pollution derived from coal burning. So this is such a low-hanging fruit to save lives, to transition away from coal burning. Again, for some countries more difficult than from others because it's the locally available fuel, but it's something that this time and age is absolutely unacceptable. In Europe, where generally we have much more access to good technologies for energy, the second world region with the highest death rate from coal, that is pretty unacceptable. And as I said, we are, although not rapidly enough, we are advancing really, really, really rapidly the adoption of clean renewable energies. Here we're looking at those kind of cleaner energies at point of use and also at point of production, not taking into account extractive activities that are generally solar energy, wind energy, geothermal. So we're not including hydro here. That is kind of quite impactful also on our environment. But as you can see there, the share of electricity generated by clean new renewables is growing really rapidly. It's growing much faster than we thought it would grow. So we are being able to adopt these technologies at a much faster rate than we had forecasted about 10 years ago, which is obviously enormously encouraging. However, I did want to note, in that graph that you see there, we've divided the world's share of electricity from renewables according to the Human Development Index of different countries. So Human Development Index is an index that, as you might know, takes into account different aspects of what makes human development, like education, health, and the economy in general. And as you can see there, it is, by and large, the highest Human Development Index countries that are leading this transition. These generally are also the highest emitters, so from the mitigation point of view, it kind of makes sense. However, you see there that the low Human Development Index countries are lagging in the adoption of clean renewable energies, and this is a health problem. It is a health problem. Oh, that's a graphic there, is empty. There you go. It is a health problem because globally, 2.4 billion people still rely on dirty fuels and inefficient energy technologies to meet their household energy needs. This is energy poverty. It means that these people, these households, don't have access to reliable electricity. Oftentimes, they rely on the use of biomass or other types of dirty fuels. They burn them often inside their homes, leading to enormously high levels of air pollution where people live, where children live. And it also leads to these families having to rely on seeking unreliable and not very easily accessible sources of fuel like biomass. Generally, it's women, generally it's children that are in charge of collecting the fuel to use in the domestic sector. So that has implications not only in terms of the energy and the air pollution that they breathe, but also in terms of keeping women and children away from education and away from employment. What you see in the graphic there on your left is the percentage of the household energy that comes from different sources of fuel. This is data that is collected by the World Health Organization. And as you can see there, 92% of all of the energy used in households from low Human Development Index country comes from biomass burning. So this is energy poverty. The flip side of that is that we often don't have any energy also to fuel our health systems in these settings. So the impacts on health are enormous. What you can see on the graphic there on your right is what this translates to in terms of household air pollution. Looking at the 65 countries that make the bulk of those low Human Development Index group, we estimate about 2.3 million deaths every year from breathing toxic air inside people's homes, deaths that could be avoided by providing clean energy sources that generally are available off-grid. It's much easier to provide renewable energies. And just one final thing, I know my time is up, that I did want to note is that we have made some progress, not enough, but we have made some progress. Between 2016 and 2021, the deaths from fossil fuels have decreased by about 7%, and this mostly comes because we've controlled emissions from coal. So coal burning has a huge capacity to save lives through immediate action. And that's all from me. Thank you very much.
Thank you, Marina. Next, we'll move on to Rob Bayless, a senior scientist with the Stockholm Environment Institute. Rob.
Okay. Thanks very much. This is a great opportunity. I'm really excited to be here and share this with you. So I was asked to present on this topic, understanding the life cycle and health impacts of energy sources. So that implied to me that I was supposed to give some sort of like micro lecture because I'm supposed to cover this topic in 10 minutes. And just to start, I want to interact with the audience a bit. Who has heard of what life cycle analysis or life cycle assessment is? Like, could you define it? Could you explain it to a 5-year-old? Okay, who has actually done one? Even for a class? Okay, I saw one hand. 2, 3, okay. So few, not many folks. Okay, so what do we mean by this? It's essentially an accounting approach to environmental impacts. So if you take literally any product, Here we're focused on energy, but literally any product, even services. You can imagine there are stages to providing that product or service. You can imagine an end product or even an intermediate product. And you can divide those stages into something roughly like this. If you, look, different sources will give you different definitions, but this captures the idea. And at every one of these stages, there are impacts. We're focused on energy here, so I'm just going to show you some from a couple of different types of energies. But anything, literally anything you use, anything you wear, anything you eat can be analyzed in this way. So I'm just putting up some things. I'm not going to go through all the details here, but I'm comparing, say, fossil systems to bio-based systems. We could also put up different flavors of renewables here. So everything has a stage, has a step, and everything has a set of inputs. Those inputs might be land, water, raw materials. For the purpose of this discussion, heat and power. Okay, but also there's social dimensions, there's employment, everything. You can analyze everything through this lens. It's actually quite a powerful tool. Now, at each stage, there are inputs, and then there are also outputs. There are emissions, there are leaks, if you're talking about a fossil-based energy system, and there are waste materials. Okay, and those generate impacts, and you can quantify those impacts, and you can quantify them disaggregated by stages. So, like I said, it's quite a useful tool, and it's a useful approach to understanding different different trade-offs between choosing one path or choosing another path. Impacts, we can quantify impacts on air quality, impacts on greenhouse gas emissions, and also other things that are of interest to me as a scientist, but maybe not so much to this crowd. Land cover change, soil water quality, employment, like I said. Okay, so for the rest of the talk, we're going to focus on the heat and power at the top as inputs, but also as products that we then use, and air quality and greenhouse gas emissions as outputs. But be aware that there's lots of things you could do with this tool. Okay, Marina just mentioned roughly 80% of global energy still involves combustion of some sort, so we're going to do a little combustion 101. Combustion is a process where you mix a fuel with air, add a little bit of heat, you get out a lot of heat. It's an exothermic process, yay. And if you do it perfectly, you get CO2 and water vapor. Very little health impact. Burns, yeah, because heat, but not a lot of impact on air quality, but of course we do get climate forcing from the CO2. However, perfect combustion is unattainable, essentially. We can get close to it in some ways, but it's unattainable. So you get a whole bunch of other things from imperfect combustion. You get aerosols, that's little particles of carbonaceous materials. You get carbon monoxide, terrible to breathe. Also, let me say that for a sec. You get methane and then non-methane hydrocarbons, a whole suite, a whole family of chemical compounds. And then you also get, depending on what's in the fuel, or if you're burning in air, you get NOx and SOx and some other things as well. What goes in comes out, essentially. The first three categories I mentioned are classified as products of incomplete combustion. If you make combustion better, you get less of them. And all of the groups are also climate forcers. They affect the radiative balance. Some of them, however, are negative forcers, and some of them are positive. And the mix is important. Okay, and picks are higher if you're burning solid fuels. It's harder to burn solid stuff because it's harder to mix solid stuff with air. And also in small-scale devices. You just can't attain ideal combustion conditions at smaller scales. Okay, so those are important to keep in mind and when we're comparing, say, a power system versus a household energy system. Okay, so one key takeaway, there are no clean fuels. There are only more and less polluting options. And here I'm using a definition of fuel, something you burn, not an energy carrier like electricity or sunlight. No clean fuels because you're burning stuff. How can we reduce the impacts? Two main pathways. We can emit less, okay, or we can separate people from pollution. Emitting less reduces both health and climate impacts. Separating people does nothing for climate, but it does, it can help with health. Emitting less, there are a few things, I'll go into a little bit of detail. Might as well take the time I have. So there are 4 different ways you can emit less. One, instead of burning stuff, use a renewable resource. Burn a cleaner fuel, okay? Burn natural gas rather than coal. Burn dry wood rather than wet wood, okay? You can make devices more efficient. Better engines, better boilers, better stoves. That means you're transferring heat more efficiently, or you're burning your fuels better, so fewer picks, like I just mentioned. Or you can make the setting more efficient. Imagine if we were talking about the built environment. You can insulate, You can use shade, you can use green, green space to reduce your demand for heat or demand for cooling. Okay, and then the other piece, separating people from the pollution, lots of ways to do this. You can cite sources, there are zoning regulations, so you don't put people where you're putting burning. Or you can introduce stuff at the sort of end of pipe, stacks, chimneys, filters, those sorts of things. Okay, this is just to show you what the impact of fuel switching would be. This is from a literature review by the National Renewable Energy Lab in the US. And it shows that life cycle greenhouse gas emissions, this is a life cycle assessment for renewable-based power generation, that's on everything on the left of your graph, is about 90% lower than fossil-based sources. And of course, there's this cascade of cleaner or dirtier, depending on the direction, of cleaner, dirtier fossil sources from coal to oil to natural gas. One thing to take away, though, there's a lot of variability here. Systems are dependent on conditions, and also your assessment is dependent on assumptions. Okay. One thing I forgot to mention with my little life cycle assessment, one thing that didn't come through there is location is important. And I guess that comes through when I mentioned separating people from pollution. So the other thing I want to show here is that location matters in this sense here. This is a version of the graph that Marina showed, but what I did was add the household air pollution component to the ambient impact of PM 2.5 globally. I also am using slightly different numbers just for full transparency. The Lancet Commission estimates about 2 million deaths from HAP. IHME, Institute for Health Metric Evaluation, estimates about 3 million. I'm not an epidemiologist, so I don't know the reason for the disparity. Takeaway, it's a lot. Whether it's 2 million or 3 million, it's a lot. And if you add that to this graph, you can see the impact from household air pollution, whether it's in the household or its contribution to ambient, is enormous. Okay? About 20% of global PM 2.5 emissions come from the household sector, and about half of all mortality comes from that sector. And it's just because when you're indoors and you're emitting, the chances of respiring that pollution are much higher than if you're outdoors. Okay, so I want to show you the impact of both fuel switching and adding or separating pollution from people at a household scale. This is from a study that I was a part of, funded by the US EPA. Shout out to them. And it shows you the cascading decrease in kitchen pollution concentrations as you either introduce cleaner fuels, introduce ventilation, chimney, or both. This is from a study in South India. And also, incidentally, we offered a couple of hundred households a range of different technologies as part of the intervention. We offered them a whole range of commercial improved biomass stoves and LPG. And we went through a series of offerings. We called them stove bazaars. It was a pretty creative study, if I say so myself. And at the end of the day, 86% chose LPG. Okay? And you can see LPG has the largest impact. If you're cooking exclusively with it, it's more impactful than having a chimney. It's more impactful than just mixing in and cooking part with LPG and part with wood. And if we pay attention to WHO guidelines, only homes that were cooking exclusively with LPG even came close to achieving the interim target 1 for the WHO. And this is also backed up. There's a really nice lit review that Dan Pope and his colleagues did. 30 seconds. All right. Anyway, this is backed up by other literature as well. All right, key takeaways. I have two slides. I won't get it in 30 seconds, but I'll try. So there are no clean fuels. All air pollution is bad, but household air pollution is really bad. And in most cases, transitioning from fossil-based to renewable energy reduces emissions and exposures in the power sector, transport sector, heat sector, but household air pollution is more complicated. Why? Well, in most sectors, we want to replace fossil fuels with renewables. In the household, we don't necessarily. The stuff that people use now, it's renewable conditionally. It's not really in practice. I spent a lot of time looking at that. But there's a massive transition underway already. It's to LPG, and that's probably a good thing. And I'll leave it there.
Thanks, Marina and Rob, for great presentations. Okay. So here comes the microphone. So we have about 10 minutes for some discussion, and I think you set the stage well. And actually, Marina, I want to start with you. I have a communications challenge. So starting yesterday and continuing today, we've heard big numbers. The number of deaths is always millions. And the challenge of communicating what that means. I'm thinking about a paper that my former postdoc, Francesca Domenici, published in Science perhaps a year ago, where she looked at individual power plants, if you probably have seen this paper, and said, in fact, she calculated the burden from a power plant where I had done epidemiological studies long ago. So the question is, how do we bring these numbers some reality? Yesterday, I think, far more impressive than 7 million was hearing about one. And so I think that we have a real communications challenge with many sectors that we want to talk to. So I'm sure you have thoughts about this.
Yeah, for sure. And that's kind of the challenge of making a number personal, making a number about people, because it's so foreign to what we can feel and we can relate to and what we can empathize with when we just say a number. It's one of the power of, as you said, kind of Ella's story and Rosmund sharing that story is just the one number that made a huge impact. The importance of having a global estimate is mostly because it helps make the case, mostly for policymakers, mostly for those that have to evaluate priorities, so different interventions. Having a big number sometimes helps, but that doesn't mean that the local impacts are not equally important. And there's a couple of stories that are really impactful and they're not captured in these numbers that have to do with the stories of those living next to flaring sites or to extraction sites. They're really, really hard to quantify the impacts of people living close to sites of flaring or of extraction, and the exposure that they have to air pollution is enormous. So I remember hearing not that long ago from people living in the Niger Delta and showing the pictures of the soot that they get across absolutely everything that they touch. And just the image of those that soot, I think, is worth probably much more than the numbers that we can put on any screen. And the other thing with numbers is they're models, right? As you said, kind of they're models that we do through different methods that we try to advance the methods and the modeling, but they're all models. So it is an estimate, it is an assumption, whether it's 3, 4, 2 million, it is in the order of millions. It's in the order of millions of people whose lives, whose families are permanently impacted by death. And it doesn't even take into account the morbidity associated. So just the tip of the iceberg. So absolutely acknowledging your point, numbers are intrinsically limiting and reductive.
Rob, a comment for you first. Thanks for the primer on life cycle analysis. I think as an instructor, I'm going to give you a very high mark. It was very clear, and thanks. In terms of thinking about the health and environmental the health costs, damages of air pollution, all our estimates actually stop when it gets into the lung, whatever it may be. And does it really continue on through the life cycle, whether that's, future exposure to waste, the environmental damage? I mean, are we missing a lot? Should we be doing a better job of thinking about the fuel utilization across the full life cycle?
Yeah, well, I think we need to, for sure. So part of the debates that I find myself in professionally, academic debates, but beyond that, policy debates, there's a lot of consensus that we need to move to cleaner cooking. So I'm going to use the household as a to respond here, and I'm going to use audience participation again because that's fun. So clean cooking is a specific category the WHO has defined. Does anyone know what fits into that umbrella? Just shout out. Shout out, come on. Gas, yes. What else? Electric cooking, yes. Renewable, but that's like, what do you mean? Well, no, let's not go with what do you mean. Solar, yes, says the solar guy, of course. Anything gaseous, so LPG, piped natural gas, biogas, e-cooking, solar, there's a couple others. Pellets, if you burn them, it's the only solid fuel category that fits the WHO's. If you burn them in a specific kind of stove, alcohol fuels as well, not kerosene though. So those all fall in. If you look at the household data, if I had done that study that I did in India with any of those, you would have seen a similar curve at that last point, exclusive use of something clean. But that's not the only thing we're concerned about, right? We're concerned about the repercussions of how you get that fuel to that house and what are the impacts there. So very important, something that we need to look at. Can I just go on with one additional point, and then I'd love to trade back. So between 2000 and 2020, about 900 million people, according to WHO models, moved from polluting fuels, all the solid fuels, coal, biomass, to a clean source. Does anyone know what they moved to? Almost entirely gas. So between that time, you have 900 million people who transition to gas. That is what I meant when I said this transition is massively underway. Good for health. Dramatically reduces exposures. What about climate? And how much should we think about trading off of those two? Well, if you're displacing dirty fuels, wood and charcoal, with gas, with bottled gas, it's actually climate win. And that's because we've looked at the life cycle and we understand it. You're reducing emissions of nearly every pollutant, and particularly the short-lived pollutants that are very impactful. And so we actually literally ran this through a climate model, and we showed that uncertainty is something we need to deal with, but we showed the central tendency is that it's a cooler planet if we make that transition. Yeah.
Okay, great. Thank you. We actually have time for a question or two from the audience. If you can talk very loud. Oh, here comes the microphone. No, not a microphone. Shout loudly.
From a health perspective, because what I thought I would hear is we're hearing on one hand mixed messages that fossil fuels are causing all the air pollution that's relating to these health harms. And I understand there's the just transition issue and there's the economic issue. But as a health conference, what is the health consensus around gas and oil as clean and healthy? Because if we aren't clear on it, we're already seeing the gas industry calling themselves clean and healthy. So what should our message be, or where do you think we are on that?
And so I will leave you to say, thank you, Brady. Good question. And I don't know whether you want to say, is gas healthy, yes or no, like the multiple choice test that was posed, or you want to say, well, so however you want to take on the question.
Okay.
And it stays between us.
It's the elephant in the room. So yes, we need to have that. We need to air it out. You always need to ask relative to what? And I think, although it's a struggle to show this with an RCT, I think it's pretty clear, at least in terms of reducing exposures, that relative to using solid biomass in an indoor setting, gas is healthy. But I know we need to be healthier, yes. And I mean, indeed, some of the reasons that it didn't actually reach the WHO standard, gas is really clean burning for PM 2.5 for sure, is that not all of the neighbors had transitioned. So the PM 2.5 we picked up in gas using households was a little bit of cooking food itself and a little bit of neighbors who were still using biomass. So if you get a larger transition, you would meet that IT1 threshold. So yeah, relative to burning solid fuels inside, it is certainly healthier. Is it as clean as burning using electricity? No. But let's think about the setting. Should we, I guess this is a philosophical question, but it's an important one that has policy implications. Who should we ask to make that transition? And how long should we ask them to wait? Because I think there's a fair amount of consensus, probably not 100%, but a fair amount of consensus is that bottled gas particularly, is the lowest hanging fruit. It's the most scalable today
So,
in many
yeah.
settings.
So let's give Marina a quick chance to say what she would like to say about the question.
Yeah, I think it's a very important point. And in understanding gas as a transition fuel, there's an assumption that you have no other transition that is feasible while minimizing the adverse health impacts. So it assumes that you cannot leapfrog, that the technologies to leapfrog to actually clean technologies to renewables is not achievable for the vast majority of the population, and therefore you have to do whatever you can do in the interim to minimize the health impacts. But that assumption needs to be scrutinized. Is it true that we cannot leapfrog in the vast majority of cases, or are there emerging markets for gas? So we have to be very careful. And one of the things that is also an underlying assumption of a transition fuel is that it's a transition fuel. So you have to transition away from, not entrench the use of gas. And what we haven't seen as of yet is that second aspect of the transition happening. So while it can be a transition fuel, that may be the best option to improve health and well-being, kind of all of those assumptions need to stay true, and wherever possible, you should transition directly to clean renewable energies, and you have to be very serious about that.
Okay, I think we are out of time. Thank you so much to both of you. And we'll move on to our panel led off by Daniel Buss. Oop. Thanks, that was great.
Thank you so much.
Thank you so much for John and the panelists that were debating here just now. I think and I hope we can continue to have an exciting panel now. We have 6 panelists. Just before I introduce them all to you, just a quick note that we take this topic as part of the global program on climate and health of WHO, as well as the action plan that is now being developed, and the whole action on air pollution, which is key as well in this debate. At the Pan American Health Organization, we do have a new mandate to work as a policy on equity-oriented climate and health action, which is very exciting for us. And also the member states have requested, and Rob was just referring to that, but in the region of the Americas, to eliminate the use of polluting fuels in households. So we have that very clear mandate from member states. But to do that, we need to understand who are the people who are using those polluting fuels in households. And what we see is that these people are exactly the same who don't have water, sanitation, and hygiene. They breathe poor air quality from ambient air quality. Even if we improve indoor cooking methods or heating methods, people are still exposed to poor air quality in their communities. They are the same that have limited access to health services. They are usually the lower income populations. They are the ones that have lower education levels. So all these compound effects is something that needs to be addressed. So we need to understand and put a face to those numbers that Marina was also showing us, and who are these people. And that's paramount to advance into a just transition, and not understanding, just seeing the numbers can hide who we should be delivering those products, services, and technologies. So this discussion is pretty much in the heart of COP30 that is coming to this region as well. So we were last week, many of us, in the CCAC event in Brasilia, and as well in the first COP30 kickoff meeting for a preparation of a Belém Health and Climate Action Plan to be presented by the presidency of Brazil to member states at COP30 that would potentially become a resolution that would cascade down to investments on climate and health. And now we are very happy to have the second global conference in Cartagena, Colombia. So I have, with that short intro, the privilege to introduce you to our panelists. starting with Jenny Miller, the Executive Director. So if you guys can please move to the stage, Executive Director of GCHA, Global Climate and Health Alliance. A round of applause as they move to the stage, please. Alex Rafalovic, Executive Director of Fossil Fuel Non-Proliferation Treaty Initiative. Thank you. James Mutari, the co-director of Clean Air Global Health Research Unit in Kenya. Shi Xiaoming, Deputy Director General of China CDC. Anumita Roy Chaudhry, Executive Director of Research and Advocacy, Center for Science and Environment, New Delhi, India. And David Foster, Air Quality Policy Advisor for Foreign, Commonwealth and Development Office, FCDO, UK. So we do have a truly global community here on stage to tackle this issue. Let's see how they'll handle the questions that we'll throw to them. So starting with Jenny Miller. Jenny, so GCHA has played an important role in advancing, in advocating for the integration of health into climate policies. So what are the biggest gaps in current global efforts to transition away from fossil fuels and also in a way of promoting health co-benefits? And how can the health sector become a more active player in shaping energy policies? Thank you very much, Jenny. Do we have the mics? We have a few mics? Yes, thank you.
Thank you so much, Daniel. And just to situate myself, I live in California. I got my start in public health working on reducing children's asthma in the state of California in the most impacted communities. In California, the growing impact that we're feeling now from the global use of fossil fuels is in more and more extreme wildfires like the ones that just happened in Los Angeles. Smoke from those wildfires is now starting to wipe out the gains that we made in air quality improvement from years of working to reduce vehicle emissions. So fossil fuel use and climate change is affecting all of us, but it's not affecting all of us equally. So my first part of my response to the question harkens back to the conversation that was just going on about use of gas and and the importance of energy access. I think one of the key gaps that we really have to address in tackling this issue is to take very seriously the importance of energy access. So as public health professionals, we know about the social and economic determinants of health. Energy access is key to many of those, to cooking, to lighting, to education, to healthcare, and to economic development. People need access to energy. This is really important to take seriously because if we don't, in the conversations about fossil fuels, we will be pitting people's core needs against this demand to transition away from fossil fuels. So we have to take that seriously. What we need, and this is, I think, speaking to Marina's point, is we need to lay out the roadmap for how that transition happens, how we make a transition away from fossil fuels that provides that energy access while moving people onto cleaner energy. And this can't be an excuse for expanding fossil fuel extraction. And part of what that means is we need to really spell out that existing fossil fuel production needs to be cleaned up and it needs to be prioritized for those people in those settings for whom right now, at the moment, it's very difficult to provide that leapfrog and that cleaner energy. Secondly, fossil fuels are still being subsidized. There are over $1 trillion US per year in direct subsidies supporting the fossil fuel industry. These are government funds going into supporting and propping up fossil fuel use. That fossil fuel use, in turn, causes health harms and a number of other harms. Governments, communities, and families bear the cost of those health harms. So all told, direct and indirect subsidies total about $7 trillion US every single year. So imagine if we redirected those resources to that clean energy transition, to providing clean energy access to everyone. The third thing that I want to raise is there are folks in the world who do not want to see a transition away from fossil fuels, who have very vested interest in maintaining fossil fuel production. And unfortunately, the fossil fuel industry is well-funded, well-organized, very determined, and they're way out ahead of us. In the last few COPs, there have been several hundred fossil fuel lobbyists attending the COPs and influencing the outcomes. We will not make headway on transitioning away from fossil fuels while we allow the industry to be in the room. And we learned this, you know, this analogy has been made before, but we learned this with tobacco. We had to get tobacco out of the room in order to make the right decisions for health. So what can the health community do? We need to become experts in the health harms of fossil fuels and be able to tell that story in personal and human ways while also having the evidence behind us. We need to get the industry influence out of the room, do everything in our power to block that influence. And then all of us need to become, you know, there's a wide variety of expertise and perspectives in this conference. We all need to use every bit of that expertise, those stories, to become active and activated champions. We need to be organized, we need to be activated, and we need to take this on very, very seriously. Thank you.
Thank you, Jenny. Thank you. And thanks a lot for all the powerful support that comes from GCHA that energizes the medical community and beyond civil society to work around these topics. Alex, you're next. So the Fossil Fuel Non-Proliferation Treaty Initiative calls for a global agreement to phase out fossil fuels. What approaches would a just and inclusive implementation of such treaty look like for different regions and economic contexts?
Thank you very much, and thank you, Jenny and Marina and Rob, for framing up this conversation. I think when we look at the question of transitioning away from fossil fuels, we have to ask, what is the first step of a transition? When you make a commitment to transition away from a product, what is the first thing that you do? You stop expanding the problem. You stop digging up more. And so actually Rob's colleagues at SEI and the UNEP have produced what's called the Production Gap Report, which outlines the plans for the extraction of coal, oil, and gas out to 2030. And what it shows is that the plans for that extraction not only blow us way past 1.5 degrees or 2 degrees, blow us way past even what our NDCs say that we will try to do in the Paris Agreement. And if it were all burned, put us on track for 3.7, 3.8 degrees Celsius of warming. So we are talking about the fossil fuel reserves of coal, oil, and gas that are already under production in the world. So the first step that we need to collectively agree to is to say we have enough, and that we can draw a line on what the UN Secretary General calls the moral and economic madness of opening up new fossil fuel reserves, and then confront the question of how do we equitably distribute the reserves that we have at hand? How do we manage the real energy access challenges that different countries face, as well as the broader socioeconomic development challenges faced inside the limits of ecological boundaries? Because we have opponents, I'm going to use that word, opposed to this transition because of their vested interests, who are trying to sell an argument that fossil fuels, that coal, oil, and gas, are actually the deliverers of development, the deliverers of health, and the deliverers of wealth. For those of us who live in fossil fuel extracting countries and economies, we perhaps can see the lie in that. I live here in Colombia. We can go up the coast to La Guajira, which is the host of most of the coal extraction in this country, and Cesar just below it. And those are not the richest departments in Colombia with the best energy access, with the highest standards of human development. Those are extractivist zones that exist to extract profit for a few, generally corporations that are from outside of Colombia, and not to deliver energy for the many. And it's the same experience. The Fossil Fuel Non-Proliferation Treaty Initiative is an initiative supported by over 4,000 organizations from across the world. And we have allies in Africa, in Kenya, who have asked the question, if oil was going to lead to wealth and energy access, then Nigeria would be the richest country in Africa with the best energy access in Africa. And of course, that's not the case. So what we have to recognize is that we're actually facing not only a technical problem, but a political problem. And what we need to do is build political power behind the idea that we need to, one, draw limits and say we can have no new fossil fuel extraction. And then two, how can we change international rules to change the set of incentives that states face when they're making decisions about their energy systems, whether that is about the extractive-based economy, whether that's about access for households, or whether that's the base of energy in their systems. And when we have $7 trillion a year going to funding the industry that is burning our lungs, burning our hearts, burning our brains, and burning the climate, we have to recognize that we're profoundly on the wrong track. And we're going to need to make a choice. We're going to need to come together to protect what we love, to protect our families, our children, the creeks, the streams, the flowers, the trees that we love. And we're going to have to do that intentionally. It's not going to be a market-led process or a technologically led process. It's going to take a political effort. And the health sector has a really unique role to play as trusted messengers on what is important for people and for their families. And so I hope that you'll join us in helping to build that political support. Thank you.
Thank you. Thank you, Alex. James, Kenya, let's switch gears a little bit and focus on some country experiences now. So Kenya has made significant strides in clean cooking and sustainable energy. What are the key policies and programs to reducing air pollution exposure and that also improves health in a participatory way, and especially to protect the most vulnerable? Thank you.
Thank you very much. I want to start by saying Kenya has a very strong commitment to one's transitioning communities and institutions to using clean fuel. Kenya is committed to have everybody, every household and every institution to shift it to clean cooking by 2028. This is in a way of implementing the Vision 2030 for that country under the social pillar. Now, that's quite ambitious, but however, there is a lot of support towards that commitment because we have seen quite a number of policies in form of executive orders from the president and also the laws developed to actualize that kind of commitment. Now, I want to start one of them by saying that in 2023, the president gave an executive order that all schools should shift into using clean fuel by 2025. Now that has slowed down from 2028. And what we are seeing happening there under that directive is where we have seen quite a number of partners like Equity Bank, Kenya Commercial Bank, Faith Engineers, State Department of Petroleum and other partners going into schools to support them in terms of shifting them into clean cooking, Faith Engineers with the steam cooking, but the rest, like Equity Bank and the Kenya Commercial Bank, moving into LPG. And then the second executive order was also issued at the same time, that's 2023, with a statement that, but this is a supported statement where the president ordered the energy sector to make sure that LPG is accessible to the communities and also institutions by removing the VAT to the gas, and also at the same time, I think it was reduced by 30%. And then at the same time also, the biggest cylinder, the smallest cylinder we have for gas that time was 6 kg. It was not affordable to the communities, but we saw the country coming up with 1 kg to support that initiative. And also the gas cylinders were also reduced in terms of cost. Now the third policy is on the law. We have a climate change law of 2016, and when this act was developed, in its implementation, quite a number of strategies have been developed to implement that act. And one of those strategies is the clean cooking transition for the country. Then there's a second one of electric cooking transition. And then also we have another strategy, and that strategy is the one from developed by coordinated by the Ministry of Health, and that is the air pollution, energy, and energy strategy, prevention strategy, and then another strategy also from the Ministry of Health coordinator was also developed, and that is the climate change and the health. All those ones were meant to implement that commitment for the country. Under also the air pollution strategy, we are seeing quite a lot of activities taking place in the country that are very promising, because we can see the government has identified 130 community health volunteers who are assigned to specific households. And with those community health promoters, what is happening is that the Ministry of Health, with the partners, they have developed a training manual, and also job-ins, so that those community health promoters can take those messages to ensure that those communities, they are able to transition to clean cooking. Those are the few initiatives that we have seen.
Thank you. Thank you very much for sharing those interministerial and intersectoral activities that are happening and shifting the way that Kenya addresses these issues. So now let's go to China. Let's travel to China. China has implemented major policies and programs to address air pollution and transition to clean energy. What has been the most effective measures to reducing fossil fuel related and producing health impacts. Sure. You have the slides. I think you can manage.
Thank you. Thank you, and it is my honor to be here to share the experiences from China about the China's clean energy transmission. I will share in 3 parts. One is for the policies, and then the actions, and then a short summary. First, China has issued a series of policies and actions to reduce fossil fuel emission. In 2022, the share of non-fossil energy was set to reach 20% by 2025, moving the original target reach 20% by 2030, ahead of the schedule by 5 years. We have taken actions to reduce fossil fuel emission, such as reducing the share of coal consumption in 2014, increasing the clean and efficient development and utilization of coal in 2017, and promoting the construction of new power systems, which is cleaner, more efficient, and smarter. Those actions gradually decrease the share of coal energy consumption from 67% to 55%. At the same time, coal power generation dropped from 74% to 58%. The emission reduction also improved air quality from 2015 to 2023. The annual PM 2.5 concentrations declined from 50 to 30 microgram per cubic meter. On the other hand, intervention measures also brought health benefits. The 2 measures, one is promote clean fuels in the residential sector and strengthen industrial emission standards, mainly contributed to the decline in PM 2.5 related excess deaths. Then I will share the experience in China's clean energy transmission. We continued to promote the clean and efficient coal utilization. This is very important. Particularly, the middle pictures show how the lower high efficiency desulfurization and denitrification technology was applied, which results in pollutant emissions 30% lower than the national standard. And in North China, as shown in the right picture, managing coal for non-industrial sectors benefited 39 million households, contributing over 30% to the air quality improvement and improving the quality of health lives. We promoted clean energy development, particularly focusing on the wind and photovoltaic power. In 2023, the share of renewable energy power generation increased to 32%, in which wind power accounted for about 10%. We take the transportation sector, for example. China has expanded high-speed rail transit to 48,000 kilometers forming a main network with 8 horizontal and 8 vertical lines. This is the whole China. Yes. Shenzhen, a large city in South China, became the world's first city to achieve full electrification of public buses in 2017. This is also have some examples about the green transportation standard, and also have we phase out about 30 million old and high emission vehicles. And also we use this smart and internet-based systems to, for example, for bike sharing, it's an emerging urban transport in China with an average of roughly 27 million rides per day. And this is the summary. Notably, we have boosted internet service to reduce pollution and carbon emissions. Yeah. So this is a summary. In the future, China continues to improve clean energy transmission. We first building a clean and low carbon energy system in rural area, because now most of the action is in the urban area. Secondly, promoting the high quality development of non-fossil energy, such as advancing construction on large scale wind and photovoltaic. And this is all the info presentations. And also I had an advertisement that we have the national conference on environment and health in August, China, in Hangzhou City, which is a very beautiful city. Thank you.
Thank you very much. I mean, I think that it's impressive to see the efforts and in so many sectors, right? And seeing how you have to tackle this issue from many angles, and that's incredible. And we may now travel to India, so it's going to be an interesting travel. Air pollution remains a major challenge in Indian cities. And what are the strategies that have worked in India? Share with us these experiences, if you can, for engaging policymakers and the public in clean energy and air pollution discussions. And we'll be very much interested in also learning your perspectives on how the communication strategies that were used to do that.
Right. So before I go to the communication strategy, just want to reflect a little bit on what energy transition in the context of clean air really means in the global south in countries like India. And very quickly, like it has been very well established, what you've said, that clean energy transition is essential for health security. But the way that transition is underway in our part of the world, that is driven by different kind of policies. There are energy policies, climate change policies. But what I really would like to reflect on, that where is that interface between clean air policies and energy transition? And do we have any lesson there? Is clean air policy really driving energy transition or not? Do we have an example from the ground? So therefore, if I just go back to the city where I come from, the poster boy of air pollution, the most polluted city in the world, Delhi, it's very interesting that when we look at what Delhi has really tried to do over the last 2 decades, a lot of action you will hear that has come out in the first generation, that how we have tried and I'll give you example of 2 sectors, transport and industry. In the transport, that we all know that the first generation target was diesel, and then when we were not even at Euro 1 level, the decision was taken to substitute diesel with natural gas. And then we moved on, then we restricted the diesel cars, we put extra pollution charge on diesel vehicles, There's a restriction on 10-year, you can't drive diesel vehicles more than 10-year-old in Delhi, restrictions on trucks. We actually put pollution charge on diesel fuel. A lot of these things have happened around diesel. But have they added up to something? So then when you look at that, what impact it has really made, and you look at the government data, our Petroleum and Natural Gas Ministry's data, it's fascinating to see that the diesel car sales in Delhi, annual level, that has gone down from 41% in 2013-14 to just about 5% today. The high-speed diesel consumption has reduced by 59%. Now, this is in the transport sector. In the industry sector, the target was coal and other dirty fuels like furnace oil, pet coke, and other dirty fuels. Now, Delhi has actually banned these fuels. And not only that, Delhi had 4 coal power plants and adding up to close to about 1,200 megawatt. All of that, the coal power plants have been shut and coal is banned. Now this is, and no other city in this country has done all of that Delhi has done. So then again, adding up, where? So when you look at the Ministry of Coal's data, you find that when Delhi was actually burning 6.9 million tons of coal at some point, it is now down to near zero. Similarly with pet coke and furnace oil. Now you will ask, so then where is the problem? And then when we look at the long-term trend in PM 2.5, it's fascinating to see that we have actually bent the pollution curve. We have reported about 35%, a little bit more, actually reduction over the last 1 decade. But, and that's where the big story is, that even after that reduction where we are today, Delhi requires yet another 62% reduction to meet our national standards, which are weaker than WHO standards. Now imagine if by doing all of that, which were not small measures, if we are here and we still require 62% more cuts, then how are we going to achieve that? And how much more aggressive the energy transition needs to be? Now the question here is, and that's the lesson, that how we have to continuously correlate the energy transition policies with the clean air policies. And here, therefore, what we find that today the air pollution scientists are telling us that Delhi's pollution, Delhi's own contribution to Delhi's pollution is perhaps about 30%. 70% of that is coming from outside Delhi. This means you have to now not only understand the problem at a regional airshed level, but you have to scale up your solutions and the clean energy transition across the airshed level. And where is the blueprint for that? And that's where it's weakening. So therefore, you have stories of wins, but at the same time, you continuously realize the new challenges. And Delhi's own problem is also showing that it's just not enough to talk about energy transition. We also have to see whether whatever development trajectory we are following, are there energy leakages? So even after doing all that we've done with vehicles, today the mobility crisis, urban sprawl, the growing distance of travel, all of that is undercutting. And understand that now the next transition in the transport sector that we are talking about, which is electrification, and Delhi has already achieved 12% electrification. Now here, what you've realized, that Delhi today has one of the most ambitious programs for electric buses. And that's actually a win-win, that a zero emission, clean technology coming for mass mobility. And you can actually make the mass commuting now carbon neutral and also zero emission. But because we have not been able to do the mobility management properly, and because of congestion, because of poor service level of buses, so you have this electric buses, more than 2,000 electric buses in Delhi today, right? But they are most of the time doing empty kilometers. So this essentially means we have not been able to join the dots. So we are moving forward, but not joining the dot that is required to get the full solution for energy transition. And that, I think, is the biggest story unfolding in our part of the world. It's not about not doing anything, it's about doing but learning all the time, that the challenges are so much more complex, that what we are trying to achieve will have to be so much more aggressive. It has to be ahead of the curve. But clean air policy and energy policies will also have to now come together much more sharply and explicitly. Thank you.
Thank you. Thank you. Very, very important points to recognize where you are and where you want to be in the future. So now let's take a electric fueled plane to the UK, right? So David, I mean, the UK sparked a lot of what's happening here in COP26. It was amazing. So what are the most impactful clean energy transition activities that are happening in the UK? And also from the FCDO point of view, what is driving forward the international support to low and middle income countries in this transition from FCDO's point of view as well?
Thank you, Daniel, and thank you for inviting me to speak today. So my name's David Foster. I'm the Air Pollution Quality Advisor at the FCDO. So in terms of the most impactful air quality and health focused policies in the UK's own energy transition, I think there are a number of things I could point to here, stretching back to the Clean Air Act of 1956, and as a result of the Great Smog. But what I wanted to focus on today is the UK health sector's own energy transition and some of the health impacts that that's bringing about. So in 2020, the UK National Health Service became the first health system to commit to reaching carbon net zero. And it's already making quite a lot of progress in achieving that. So through things like renewable energy adoption and energy efficient hospital systems, the UK Health Service has already reduced energy equivalent to that needed to power 1.1 million homes in the UK annually. So they're making progress. But I think in terms of air quality and health specifically, it's the NHS's move towards electric vehicles, which has some of the biggest potential impacts. Now, the vehicles of a health service, decarbonising those might seem a bit small fry, but the NHS operate the second largest vehicle fleet in the UK. It's about 10 million road miles worth of vehicles every year. That's about 3.5% of the total in the UK. So significant numbers. And those vehicles, the fleet vehicles, as well as sort of staff travel and things like that, account for about 36,000 deaths in the UK every year as a result of air pollution. And so the NHS has committed that by 2030, all new vehicles will be zero emission, and then the full fleet decarbonised by 2040. And some NHS trusts are already there, are already fully electric. So clearly you can see how those sorts of initiatives are going to save thousands of lives every year, and I think are quite a good example of a health-focused policy. The other set of policies I wanted to mention, and this is at the sort of the regional, the city level, and we've spoken a lot in this conference, I think this week, about work at the subnational level, are the clean air zones and the ultra low emission zones. Now, these are, in the UK, air quality is a largely devolved area of responsibility. So it's the Greater London Authority and local councils who are responsible for this. But I think when people think about air quality and health activity in the UK, it's probably one of the things that springs to mind most immediately. And I wanted to mention it because there's been some research published very recently on the impact that those schemes have been having. So in London, roadside nitrogen oxide levels have dropped by 27%. And PM 2.5 from vehicle exhaust is 31% lower than it would have been without the ULEZ. So these are really sort of significant numbers which have led to fewer cases of asthma, bronchitis, and heart-related illness. So I think those two things are just a couple of examples of policies from the UK's own energy transition that have had impacts on air quality and health. The other question you asked me was about how the UK can support low and middle income countries in developing equitable transition strategies and how health can be sort of prioritized within that. I think the thing that immediately springs to mind on that is the UK's work through the Just Energy Transition Partnerships, or the JETPs as they're known. So JETPs are multilateral platforms which aim to accelerate the transition of developing countries towards clean, renewable, and secure energy. And health is absolutely a crucial part of doing that. The aim of this is to support partner governments to achieve their plans, but at the same time to mitigate the impacts on the most vulnerable people in the community. So in South Africa, which is the JETP that the UK lead, we're involved in 4, but we lead the South Africa one. So we're ensuring that health impacts are absolutely central to that partnership. One of the ways we're doing this is through funding research. And just a couple of weeks ago, some research was published by the South African Medical Research Council, who are here today, which UK funded, and it showed how communities that are living near coal-fired power stations were 6% more likely to experience health impacts from air pollution than those that weren't, and that children were particularly badly affected by that. And I think it's through building those sorts of evidence products and really improving that evidence base on health equity impacts. I think that's really important in terms of ensuring that efforts like JETPs are informed by the best science. And I think that doing that in an integrated way, so having that research done as part of an integrated approach with something like a JETP, is a good way of ensuring that those findings and that those recommendations are really baked into those energy transition strategies in developing countries from a really early stage. And I think that's probably how we're going to see the most impact. I think I'm out of time. I'll leave it there. Thank you.
Excellent. Thank you very much. That was exactly what we wanted to hear, I think. And thanks for being such a committed and disciplined panel. I think with that, we still have time. I had preset questions, but I think I preferred, to collect 2 quick questions. Please, very quick interventions from the audience. Then we give the speakers the chance to address them, and then we can wrap up this panel. Thank you.
Thank you. I feel like the question that's hanging over this session, and I ask it to the panels, is whether or not natural gas, one of the 3 fossil fuels, is or is not, from a public health point of view, part of the energy transition and indeed a clean fuel. We know it's not from a climate point of view. Natural gas is at least as bad as coal, and in the case of LNG, is 30 times worse. The data are in on that. But from a public health point of view, I ask because I appreciate that coal and wood are solid fuels that combust more incompletely, but while they're sitting there in a pile, they're not creating air pollution. Natural gas, on the other hand, is inherently ungovernable. It leaks from the moment the drill goes into the ground all the way through the pipelines, the compressor stations. Flare stacks are used to control the pressure, putting carbon black into the air, lots of particulate matters. And at the end of the pipe, in our kitchens, nitrogen dioxides are created, as well as benzene and radioactive particles that are in the fracked gas. So from a public health point of view, do you consider natural gas to be clean? And should we use natural gas as part of the transition to renewables, or do we leapfrog straight into renewables? Thanks.
Thank you. Fair question. We have the lady back there. I'm sorry, we have to jump to her, and then the panelists can pick and choose what they want to reply to.
So thank you very much, panelists. So I hope in another conference like this, we would want to hear from the energy health transition. We've been talking about energy transition from fossil fuels, dirty to cleaner. Ultimately, we are saying the goal is healthy nations, healthy to the people. But now, let's do the reverse. What are the health gains so far for those who have moved forward from energy transition from dirty to cleaner fuels? Is there a correlation in terms of the health gains that we have been talking about, so that it motivates those who are still using the dirty fuels? So what drives the agenda? health gains through energy transition resulting in clean air, or energy transition resulting to better health? Where are we exactly? I submit.
Great question. Great question. Thank you. So, fellow panelists, who wants to take the first stab? Jenny, can you pass the mic? Yeah. Thank you.
So to address the second question in part, there is no question that transitioning away from coal delivers health benefits to the communities that are impacted by exposure to those coal emissions. And that's been demonstrated in multiple countries now where coal use has been reduced. I think to speak to the first question, I would refer back to the comments from both Marina and Rob. You know, we have to think about this as a process and also drill down on the where and the who and on what the other options are. So again, in California where I live, there have been moves to ban gas stoves in new construction. That is a really important move for health and will reduce some exposures to benzene and other toxic co-pollutants of natural gas. The evidence, and I'm not the right person to turn to for the evidence on clean cooking based on gas for communities that are currently relying on biomass, but those who are the experts in that consistently say that that's an important transition. So to refer to Marina's point, the question is, in a community, can you leapfrog to the cleanest possible source, so solar or other kinds of clean renewables? If you cannot currently make that transition for a community that is relying on burning wood and biomass in the home, then gas is a transition fuel that is cleaner, that's better, that's part of the process. So that's why in my remarks, I was really calling for us to map out this transition. It's not simple. We need to think about who and where, who needs what kinds of fuel, where we can reduce, where we can leapfrog, and need to talk about that in a nuanced way.
Thank you, Jenny. Please go ahead. Anumita.
Okay. To add to that point, and I'm sure that this natural gas question has also come up in the context of the transition that I've just mentioned in Delhi, and that is in the transport sector. And I think it's very important to understand that one is what science is telling us about the health risk. And there is something called the technology and the fuel ladder that we keep climbing up. And depends on what economic and social context we're talking about in the global south. When you have very few choices, then you have to do what you have. You know, that's a kind of very expedient kind of decisions that are taken. So when the first generation decision in Delhi was taken, that how do you counter dieselization? At that point of time, you have diesel with 5,000 ppm sulfur fuel, right? And you're not even at year one level. So then the best leapfrog at that stage was CNG, right? The fuel substitution. But we are not going to say the same today, because today now the science has evolved further. We have much better data, technology has evolved more. And today we are saying, and based on all the remote sensing measurements that have been done on the CNG vehicles, that how the real world emissions are significantly high today in Delhi. Now that means for us, we have to now there's a second leapfrog is needed today for us, which is the electrification, but then connected with electricity, the clean electricity. But it's very interesting, but even today when we are taking those decisions, and the studies are telling us, and what you have actually mentioned earlier, looking at the life cycle emissions, etc., that current studies are showing that even at the current grid mix that we have in India, the coal at 70%, electrification is still cleaner than ICE. So then we will move in that direction, right? That's the question that for us. So every stage of energy transition, you are presented with different policy choices, technology choices, and you have to be expedient, but at the same time, try your best to leapfrog as much as you can. And the health issue that we have just said, that is it. So at the end of the day, if we are doing all of this, why are we just saying, okay, the air has cleaned up? Why aren't we not translating that into real health data to say whether the health is benefited from that change or not?
Exactly.
First of all, in Delhi, the most important thing that has happened is that all this that has happened, the battle has been won based on right to life. And continuously, the decisions have been taken by giving to the court, the Supreme Court of India, what is going to be the health benefit of taking all these decisions. So, and the decisions that have been taken, including India's leapfrog from Euro 4 to Euro 6 directly in 3 years. Now, the numbers are available actually to show that that is going to avoid about 2.1 million deaths over a period of 2020 to 2040. You know, those numbers have been crunched to great extent. But I think we really have to keep doing that to show that what action we are taking, not only how that is translating in terms of cleaner air, but where the health gains are. And that will, I think, be a lot better, a much stronger propeller of change.
Excellent. Thank you. I just want to give 10 seconds to Alex.
I think we need to stop using the term leapfrog. I think we need a pole vault because I feel that perhaps we're missing to some extent the urgency of the climate crisis. The marginal differences in health outcomes are really important and they have a great deal of impact for people. But on the global scale of our policy making, we are catastrophically off track for managing the balance of ecological systems on this planet. We are looking at the highest levels of greenhouse gases in our atmosphere in recorded history, in the history of our species' existence, and probably beyond that. We're looking at the retreats of ice sheets that have been unprecedented again during the period of human existence. And that is driven by the fossil fuel system above all. That fossil fuel system which causes these health harms that have been outlaid today, and our approach of going slowly and doing business as usual and coming up with a set of loans to try and change from gas from coal to gas is not going to cut it. And I think actually the challenge for us is to change our way of thinking about the problem that's in front of us, to drastically scale the amount of cooperation that we're prepared to do and the amount of solidarity that we're prepared to show, to pole vault over the industry that is polluting our homes, our houses, and our planet. Thank you.
Thank you, Alex. Oh, thanks, Alex. Thanks, colleagues. You want to, James? 5 seconds.
5 seconds. Thank you very much. Yeah. Let me join this debate about the natural gas, and particularly in regard to LPG. I know in five countries where we have been evaluating the impact of LPG on the respiratory diseases or health of the population. And I want to say that we might paint LPG as a very, very bad gas, but that is not the case what we are seeing, because mainly in public health we have been evaluating, we have been looking at two health damaging pollutants. One is PM2.5 and carbon monoxide. But what we are finding is that use of LPG has been able actually to reduce respiratory diseases to significant levels in the populations compared to those ones who are using biomass. However, in the past, we have not been incorporating other parameters like the nitrous oxide, like the volatile organic compounds, but now we have incorporated because now we have a facility to measure them. We have already, of course, taken some measurements in those countries, but we haven't analyzed to comfortably say that I can now give you some of those levels, what we are getting from the households that are using LPG. Having said that one, I tend to think also it's difficult for us to say at once, let's move to renewable energy immediately, and citing, of course, electricity, because it has also its own actually difficulties in terms of transitioning. We have to move a little slower, not very fast, but that's where we are ending up. But to be very honest, we know the LPG we are trying to condemn here, I don't know whether we are trying to condemn, is the most scalable among all those actually options we are talking about. So as we condemn something, let us also look at some of the benefits, and let us be, and particularly when we're talking about public health benefits, we are accruing some of them, but I leave it now to the audience, of course, because we are saying what we are providing the populations is first of all options, then those options are followed by the transition. And every country like Kenya, we have a energy transition. We know even when the country is supposed to use, at what point they should use actually say ethanol as an option. So I think that's what I have to say to the audience.
Thank you, James. Thank you. And that shows the complexity of this issue, right? There's no silver bullets to this thing, but we have to continue these dialogues, and we have to continue to understand which contexts these solutions are more appropriate, and culturally, including culturally appropriate to each of these contexts. But my final message here is that let's use more the health argument to drive the change. And let's use health indicators and health equity indicators to measure progress. I think that this lens is something that can unite a lot of the interventions, technologies, and activities that are being proposed here. And I hope that we can continue to push forward to have those indicators, to have those integrated systems so we can understand air pollution, health surveillance, and multi-sectoral action, and how they can all deliver better health and well-being for the population. I think that that's a common thing that we can try to achieve using these multiple perspectives and visions that we are hearing here today. So I would really like to thank the panelists, the ones that preceded us as well in the first part of this panel. Thanking Wen Lu, she was amazing working behind the scenes. Often we don't recognize those roles, but thank you very much. And also to our interpreters who helped us during this day. Thank you very much. You too, John. Hello. I know. Oh, we are a big group.